First of all, I'd like to welcome everybody to this wonderful presentation by Dr. Levy. He's an important figure in my life for the books that I've read and the impact it's made on me personally and also in our cardio group. And what I truly appreciate is that the generosity of spirit. You could download or purchase the books. This talk is free. This is pretty extraordinary nowadays. And also he's somebody who is alleviating suffering of mankind and empowering people, putting tools in our hands, which is so a nice way to do it today. In 2016, he was inducted into the Orthomolecular Hall of Fame. If you don't know orthomolecular medicine, go to their website. In summary, orthomolecular medicine is the practice of preventing and treating disease by providing the body with optimal amounts of substances which are natural to the body. So that's what today is about, is really another application of orthomolecular medicine, giving the body what it needs to do what it knows to do, because the body has quite a bit of intelligence. And the second part of today that I'm so grateful for is everybody here who hasn't forgotten that our body is designed for self-healing, that our body has great intelligence. It just needs the materials to correct itself and heal itself. And we have one person on the call today who just got diagnosed with COVID today. So this is the perfect time for her to be on this call.
What I want to talk about today is the most recent book, Rapid Virus Recovery, along with some of the information that's been accumulated since then, which is substantial, I think you'll agree, as we proceed. And the subtitle is extremely important too, because I believe most people now realize that, are assimilating everything, let's put it that way, that the major damage of this is the fact that most of the people on the planet are petrified. And when you realize this is something that's easy to prevent and just as easy to cure once you have it, it goes a long way toward alleviating that fear. And that was actually the case with me. I'll be honest and say in March of last year, after my good friend, quite healthy, nearly died of COVID, I wasn't using the peroxide nebulization in that fashion at that time. And since one of my major phobias is shortness of breath and losing breath, I was petrified. So I understand, I really do, what people are going through. I just hope we can get enough education out there so that they realize they don't need to be petrified. As with all my presentations, when there's a significant point being made and you see a number, you can go to this website, the PubMed website, type in the number, and you'll immediately see the abstract and oftentimes the entire article to see where it is I pulled out a particular fact. From time to time, I'll synthesize the facts and reach my own conclusion, and I try as best as possible to let you know when I'm putting together my own thoughts versus citing something directly from the literature. Now, the cause of all disease is very important to understand as we go into why what we're doing works. And in a nutshell, all disease is caused by increased intracellular oxidative stress, oxidized biomolecules. When the levels get high enough, you have significant disease. When they get even higher, you have malignancy. And then when they get higher than that, you have death of cancer cells. But it's all within that realm of oxidative stress. And okay, there we go. One of the most important principles here is there's a lot of terms thrown around loosely in the literature. Everybody hears about oxidative stress. Everybody hears about toxins. Well, a toxin is something that takes or causes to take electrons away from normal biomolecules. This is oxidation. An antioxidant like vitamin C, but not limited to vitamin C, gives or restores electrons back to those oxidized biomolecules. And why is this significant? This is significant because when a biomolecule, DNA, RNA, protein, sugar, lipid, fat, enzyme, when it gets oxidized, it loses its function. So it's like a blank key in the lock. You now have a molecule occupying space, but not performing its normal function. And when you get a large enough number of different biomolecules in different locations and different concentrations oxidized, that's when you have a disease. You don't have any disease above and beyond a unique array of biomolecules being oxidized. Now, when vitamin C or another good antioxidant can come in and donate electrons back to those molecules, they restore their normal function. And in a nutshell, that's really all there is to disease. Now, taking care of disease and treating disease is actually a lot more complicated than understanding why the disease is there. But make no doubt about it, when you have someone with a degenerative disease, Parkinson's, this, that, or the other, the cells don't have Parkinson's. They don't have some ill-defined disease process other than a unique array of oxidized biomolecules. And that's an important point to remember, because all chronic disease is this oxidation. And then you might ask yourself the very valid question, well, if all chronic disease is oxidized biomolecules, why doesn't vitamin C or other known good antioxidants cure these diseases? And they would if you were not adding new oxidized biomolecules on a daily basis. And this is what usually comes from the mouth and from chronic pathogen colonization in the affected tissues. So in the case of Alzheimer's, for example, they've actually isolated oral pathogens in the tissue samples taken from Alzheimer's patients. So when you have indwelling pathogens in a given tissue, then you have a nonstop ongoing supply of new toxins and new pro-oxidants. Now, there we go. Okay. So I just went over this slide, and now, so what are the prominent promoters of chronic degenerative disease? Infections, of course, mainly dental, statistically speaking. And the reason why dental are so much important than other infections, you could have an infection anywhere in your body, have an infected gallbladder, this, that, or the other, and it would provide toxicity to the body. But the thing that's diabolically unique about the dental connection is when you have infected gums or teeth, you also have a perfect delivery system of the toxins and the pathogens into the bloodstream and into the lymphatic system. So this is what makes these focal infections so much more body-wide toxic than any other infection anywhere else in your body, because you don't chew on your prostate, you don't chew on your gallbladder, so you don't have the direct connection to the blood supply and the lymph. Chronic pathogen colonization, that's where we're going to go in some detail today. Other toxin exposures, heavy metals, pesticides, toxic iron status. As we see at the end of this one, I mentioned calcium and copper. Iron, calcium, and copper are what I call the three toxic nutrients. You absolutely need them for life in certain very minimal amounts. And above that, they are all universally highly toxic because they're all pro-oxidant. Pro-oxidant equal toxin, equal free radical, equal poison. These are all the same things The literature likes to use all these different terms, and then people get confused as to what they're talking about. But the only thing that causes disease is something that oxidizes. That's a toxin, that's a pro-oxidant, that's a poison, that's a metabolic byproduct of a pathogen growing. And what else happens when the pathogens die? Well, when the pathogens die, they release an enormous amount of free iron, because that's what fuels pathogens. Then dietary toxin exposures. Just remember that poor digestion is worse than poor diet. So primarily try to understand what can give you a couple bowel movements a day rather than what does or doesn't have certain contaminants, this, that, or the other, because if you digest poorly, you're going to have far more toxicity with a perfect diet than with a lousy diet perfectly digested. And then finally, hormone deficiencies all come into this, primarily sex hormone, thyroid, and cortisol. And this cortisol is just something I'm researching right now, and the connection to all of this is enormous. It's something that doesn't get emphasized enough, but I'll be emphasizing it in the future. Now, I mentioned this already. So the thing that causes disease, the appearance of new oxidation, ballast against the reversal of old oxidation. Now, coronavirus. Let's get down to the weeds here a little bit. It's substantially different, even though it's technically a respiratory virus. There's a lot of debate about whether it's a virus or not. We won't get into that. Let's call it a virus. And it's quite different from the regular flu insofar as it causes severe lung inflammation, severely decreased oxygenation, all if not appropriately treated. And this is something I want to emphasize here. We talk about long haul COVID and chronic COVID. I'm going to tell you, those are syndromes where you still have a low grade COVID infection that you're indwelling, coating your airways and your pharynx, still present in the stool. And the people that get that type of syndrome are twofold: the ones with the poorest immune systems, and number two, the ones that never took a true antiviral intervention for their virus. Okay, so all the prescription drugs, none of them knock out a virus. Okay, and certainly sitting on a respirator for a month doesn't knock out the virus. The only thing happens is maybe your immune system kicks into gear and you hold it down, and then you stay chronically ill for an indefinite period of time. And that's because you haven't knocked out the virus. We're going to talk today, along with the hydrogen peroxide nebulization, vitamin C, ivermectin, hydroxychloroquine, chloroquine, ozone therapies, ultraviolet blood irradiation, hyperbaric oxygen therapy, even the antibody immune infusions. All of these things can work to eradicate the virus. So I repeat, just don't think you're going to get over it by bed rest and fluid, even if you're young and even if you're strong. It's very easy to leave a chronic infection behind. So as we know, it frequently hits the elderly hard, and practically not at all in the very young. But the interesting thing about it is it's incredibly diverse in its clinical presentation and severity. Typical symptoms: no symptoms. It is exceptionally contagious. A lot of headache, weakness, not feeling right, chills and sweats, and one real biggie that's kind of unique: the loss of smell, taste, and appetite. And also a lot of diarrhea and digestive symptoms. And this is going to come back to what I was talking about: pathogen colonization in the nose and the throat. When you chronically swallow virus-related toxins and virus itself, you're going to screw up the gut. And the most common symptoms: diarrhea, discomfort, etc., all the different gut symptoms. The shortness of breath is the biggie. If you have COVID and you start getting short of breath, you need to do the interventions we're going to talk about here right away, because in my humble opinion, right now, worldwide, if you get short of breath with corona and then go to the hospital, there's an excellent chance you're going to die because they just won't give you what you need. And I don't know how much clearer to make it than that. I can't comprehend all the politics that's involved here, why established medications like ivermectin and hydroxychloroquine are somehow conspiracies now rather than the legitimate drugs that they've been for decades. But you need a specific potent antiviral to completely get over this and not allow it to progress to acute respiratory distress syndrome that can be rapidly fatal. Now, one thing to remember too is some of these different supplements, I advocate a lot of magnesium chloride. Magnesium in general, obviously you need, but chloride specifically has a very potent antiviral agent all by itself. And you can see by this slide that just like we were able to see that vitamin C as a monotherapy back in the 1930s with Dr. Frederick Leonard, 1940s, excuse me, in the middle of a polio epidemic, he was able to cure 60 out of 60 cases of acute polio in babies, children, and a few young and a few teenagers. And he was able to cure them in 5 days. Actually, 57 out of 60 were cured in 3 days. Well, we here see that this Dr. Nouveau in France in the 1940s, when polio was big over in France as well, that an even wider age range, he was able to quickly achieve cures just with oral magnesium chloride solution. Now, let's see, yeah. These are my general supplement recommendations. I mean, especially regarding coronavirus infection and prevention and treatment if you have it. Same thing applies. If you're diligent beforehand, you're much less likely to get it, but no prevention is perfect because you never know how high a concentration of virus you're going to be exposed to. A big enough virus exposure is going to allow you to contract the infection pretty much regardless of what's going on. Then it's just a question of how quickly you can get over it. So again, a general recommendation. This does not mean there's not many other wonderful things you can take. Vitamin C, people say how much? Really, just about as much as you can take, but people that want to hang on to a figure, 2 grams, 3 to 4 times a day. Okay, that's 2,000 milligrams. That's 2,000 milligrams, 3 to 4 times a day. Any magnesium supplement that you can find, but best if you go with the magnesium chloride as described here. Interestingly enough, chloride is very antiviral. They actually did an experiment where they looked at magnesium chloride versus magnesium sulfate. In cultured viral preparations, magnesium sulfate encouraged virus replication and magnesium chloride suppressed it. So you can't ignore the anion. Every supplement, for the most part, has a cation and an anion, and we tend to just concentrate on the anion, except maybe in the case of vitamin C, that's where you concentrate on the anion, the negative charge. In the case of magnesium, you concentrate on the positive charge. Vitamin D, very important. Zinc, very important. Things like quercetin are also very good and work with the zinc to get zinc inside your cells, which helps shut down viral replication rapidly. And we're going to talk about the hydrogen peroxide nebulization. And unless you have a doctor that's out of contact with reality, you absolutely get your ivermectin, hydroxychloroquine, chloroquine. They all work very, very, very well with virtually zero toxicity. So don't listen to the incredible garbage that for whatever reason is being put out there to discourage individuals and doctors from using these agents. Now, hydrogen peroxide nebulization, completely non-toxic, very effective in killing any pathogen encounters. 3% or less nebulized, and very, very good, especially for prevention, but it's very good for cure as well. I'll show you that in a moment. I often tell the dentist that I talk to, I mean, you have a profession where you have your face in front of goodness knows how many pathogens on a daily basis. No matter how you feel, you should probably nebulize for a minute or two at the end of the day. Certainly, if you're living in a household with one or more family members with COVID, practice this nebulization regimen. It's also always the perfect adjunct. By that, I mean, if you have ivermectin, if you have hydroxychloroquine, don't tell yourself, well, I've got it covered, there's no need to take the peroxide. That's just crazy, because the peroxide is uniquely capable of not only killing the pathogens that are in your nose and throat, but also is stripping away the biofilm that would already have developed, keeping it from being killed. So this is what feeds the virus content throughout the body, all right? So you need to, as I say at the bottom, effectively chop off the head of the viral snake, and then it's much easier for the body, the other interventions you take, and your immune system to go ahead and mop the infection up. Now, very important slide here. Let me give you a little background here. My wife's from Colombia, and about 3 months before the pandemic started, I was visiting family and friends, and a friend of my wife's, a young lady, had a significant cold, was coughing a lot. Now, I had already been working with peroxide nebulization for a couple of years, just for general viral infections. COVID didn't even exist at this point in time, and allowing me to get over lifelong sinus problems and lifelong chronic cough problems. So I gave her the nebulization. She got over it very quickly, stopped coughing almost immediately. And she kind of begged me to leave the nebulizer with her for family members and stuff like that. So I said, sure. I left her the nebulizer, and I left her a bottle of hydrogen peroxide. Well, 3 months later, COVID hits, 4 months later. Well, fast forward then a year and a half, and I go back to Colombia to visit again, and I have the possibility, have the occasion to see this young gal again. Well, she has sort of since then become the local treatment guru in her barrio in Colombia for COVID. And she did some phenomenal work. As you see right there, she saw 20 advanced COVID cases. Advanced COVID because they were all severely short of breath. And if you're severely short of breath and you have COVID and you're not taking a specific antiviral, I'm sorry, but you don't have long to live. She gave them full strength, 3% peroxide for 30 minutes, 3 times a day for 5 days. Well, after 5 days, she cured 20 out of 20. Very significantly, the 3% aggravated a few of them at the outset, but they felt so quickly an easing of their breathing. They said, oh, I don't care if it irritates or not. Go ahead and give me the full strength. So they all got full strength for the first 3 days, and then got a lower concentration the last 2 days. Now, let me try to emphasize why this is so significant. This is so significant because I could never have ethically found out how effective hydrogen peroxide nebulization is had I seen these patients, because I would have to, and I would want to give them everything that I knew. Ivermectin, vitamin C, you name it, everything together, and add the peroxide to it. Well, I repeat, these were poor people in a poor barrio. They didn't have the simplest supplementation. They had nothing but the hydrogen peroxide nebulization. So this as a standalone monotherapy, cured 20 out of 20 advanced COVID cases. And I'm just pointing this out to show you how potent it is. I'm in no way ever advocating using it by itself when you have access to any of these other modalities as well. Use as many as you have. Some facts about hydrogen peroxide: all-purpose antibiotic in the body. Very small molecule that readily passes through the membranes surrounding the cells and the membranes of pathogens. Also significant, it's continuously generated throughout the body, and it's always present inside and outside of the cells. Now, it's known as a reactive oxygen species, which usually means it's unstable. That's actually incorrect, because although it is technically a reactive oxygen species, it's highly stable. It only becomes reactive when you have the right microenvironment of pathogens, increased iron, and an electron donor like vitamin C. It's been, as far as I know, never found a pathogen that it won't kill. Very significantly, no toxicity. No toxicity at the recommended protocols. You can make anything toxic. Okay, so when they talk about what 35% or 50% of hydrogen peroxide can do to your lungs or your body or burn it or this, that, or the other, they're absolutely right. And every other prescription drug and any other, even many natural agents that you take highly concentrated, are going to do damage. About the only one that I know of is vitamin C. There's never been an established toxic dosage of vitamin C. But bear in mind, psychologically upset individuals can develop water drinking compulsions. And it's been well demonstrated that if somebody drinks, 3 or 4 gallons of water in 15 or 20 minutes, you're going to go into brain edema, have seizures, and die. Well, all you did was drink water, and now you're dead. So we don't usually think of water as being a toxic substance, but it can be made a toxic substance. So just tune out when naysayers start talking about, hydrogen peroxide, how deadly it is, etc. The next point is very important. And this is not the case with antibiotics, I might add. Not that antibiotics could cure the virus anyway. That's another story. After the pathogens have been killed by the peroxide, what does it leave behind? It leaves behind water and oxygen. It leaves behind the 2 most ideal substances for repairing and healing tissue that was damaged by an infection. Water to hydrate, oxygen to oxygenate. And think about this: water is H2O, oxygen is O2, hydrogen peroxide is H2O2. They are all cousins, and they're all continuing to interact all the time throughout the body. Because of this, peroxide also acts as an oxygen storing agent. It's actually holding oxygen, waiting to deliver it when the environment dictates it. When you inhale, up to 5% of the oxygen that you inhale with every breath gets incorporated and synthesized into new hydrogen peroxide in your body. There is nothing more natural inside your body than hydrogen peroxide, even though it's a very effective disinfectant outside the body. And if you use it in a concentrated fashion, yes, it's a very effective bleaching agent. It all has to do with minimal, moderate, maximal oxidation. That's it. Oxidation is the key. And if you oxidize something severely, like iron, it rusts, okay? It degrades. Hydrogen peroxide is naturally present in the urine. And look at number 9. And think of the significance of this. This was actually what triggered me to even think about using the peroxide for COVID. Is I just ran across an article and I saw that hydrogen peroxide is naturally expressed from the cells that line the airways of the lungs to literally coat the lining of the airways to do what? To serve to kill any pathogens that come in on every new breath that you take. And it's been documented as being present in the exhaled breath. And when you have a lung infection, it's present in the exhaled breath in a higher amount. So all we're doing with hydrogen peroxide nebulization is supercharging and augmenting the body's natural response, that when you get too much virus all at once, that natural response is not sufficient to deal with it. Vitamin C and hydrogen peroxide, wonderful things that work together. Remember, pathogens thrive on iron, and we actually have shown that iron chelators decrease pathogen growth. And some of the most significant antibiotics are iron chelators, like Vibramycin and tetracycline. There's something called the Fenton reaction, by which you kill a pathogen in the cell. Okay, it's fueled by high dose vitamin C, goes into the cell. There's iron in the cell. It takes iron 3+, makes it a 2+. Then that electron goes to the hydrogen peroxide, which forms a severely oxidizing agent called the hydroxyl radical. When this is present in significant doses for long enough period of time, you oxidize and effectively destroy either the cell or the pathogen or both. This was a phenomenal finding for me because it gave me, for the first time in 25 years, a completely logical reason why high dose vitamin C is so uniquely capable of eradicating virtually any infection, certainly any acute infection, viral or bacterial. Why? Large amounts, 50 grams, a lot goes into the cell and does this so that the peroxide in the cell makes hydroxyl radical. And then guess what? At the same time, it's massively increasing the production of new hydrogen peroxide outside of the cell so that it can go inside the cell and continue to fuel the reaction. Anytime you want an effect that's being fueled by a chemical reaction, you have to continue to give the reaction substrates in adequate quantities for it to continue until you get the final result that you want. So vitamin C donates the electrons, kicks in the hydrogen peroxide, and as a little final bonus, the hydrogen peroxide, once it's inside the cell, also mobilizes new iron into the cytoplasm from its storage sites in ferritin. As they would say, incredibly elegant. Multi-C protocol, just to remember, oral liposome encapsulated vitamin C. The only really quality one is Live On Labs, and they have a company that Live On works with in Europe called Altrient, Altrient, Altrient.com, that has the same product. High doses of sodium ascorbate powder work to minimize gut toxicity. Ascorbyl palmitate is a fat-soluble form of ascorbitate. It works well to deal with cell membranes. Of course, the variable IV applications, even intramuscular, especially useful in babies and young children. And you might want to take note of this website as well. There's now an agent that actually appears to compensate and undo, in many people, not 100%, but a very high percentage, to undo the epigenetic defect that keeps you from making the fourth enzyme in a 4-enzyme sequence in the liver to convert glucose into vitamin C. And we've actually documented that you take this product, you give a toxin, in this case alcohol, and rather than the vitamin C level drop as you start to use it up, it kicks the liver into high gear and you start making more. arguably one of the most significant, if not the most significant supplement for what it does in history that I know of. Chronic pathogen colonization. Well, first, remember that pathogens occur in a body-wide fashion, like when you have the flu. They occur in a focal and concentrated fashion, like when you have an abscess. And then they occur in a more diffuse, less concentrated manner over a mucosal surface or any sort of exposed surface. And the nasty part about it is once they do that, they stay there and never go away. They never go away until and when you finally apply a protocol or an intervention that not only destroys the biofilm, but then kills the pathogens. And no, I repeat, no prescription antibiotic is capable of doing this. None of them can penetrate the biofilm. So for the most part, if you've had a cold or flu, or we talked about COVID, long haul COVID, and you never took a specific potent antiviral intervention, you are going to have some degree of chronic pathogen colonization for the rest of your life until you take an intervention. This is why gut problems are chronic. You have toxins being produced by pathogens in your upper airways, the aerodigestive tract, and what are you doing 24/7? You're swallowing them. And what did we already say causes all disease? Oxidative stress from oxidizing agents, which is what viruses are, which is what bacteria are, which is all their toxins and all their side products. All of that being swallowed regularly, and you don't have a chance of having a normal gut. You don't have a chance of having a completely normal microbiome, and you don't have a chance of having a completely intact gut that's not going to leak these products to a greater or lesser degree totally throughout the body. And I just said that. Important thing to remember about the intestinal epithelium is these cells replicate every 3 to 5 days. So for all intents and purposes, in your proximal gut, once every week you have a new gut. Well, why, if you have a new gut every 7 days, does it stay leaky and does it stay sick? Because you're continuing to swallow the pathogens and the toxins. So leaky gut, in my humble opinion, is not so much a chronic disease as it's a chronically induced acute disease. You regenerate the cells, you repoison them all over again, and it just continues like that until you chop the head off the viral snake or the bacterial snake that's living in your sinuses, pharynx, tongue, and even lungs until you address them. This is put in a nice little nutshell by my mentor, Dr. Huggins, some 25 years ago. I was talking about a similar concept, not the same thing, because I wasn't even thinking along these lines 25 years ago. But when we're talking about resolving disease, and he said, Tom, he said, you can't dry off while you're still in the shower. And this is so important because there's really 2 phases to disease. And that is new damage and repair. If you stop the new damage, you can repair and completely resolve virtually any disease. The problem is, as I said earlier, is these chronic pathogen colonizations are not just in the throat and in the nose, they also make their way into the tissues that are affected by a chronic disease. And that's why the disease stays chronic, is because there's always a new source of oxidative stress 24/7. So that if you're a very vigorous supplementer, you can get anywhere from no improvement to minimal improvement to moderate improvement to tremendous improvement. And it all depends on how much new damage you're bringing in and whether or not you're compensating enough on a daily basis to get more improvement than worsening. Gluten, peanuts, food products. I don't have the hard data to show you yet. I do have many people whose diarrhea has cleared up after having years of it, after a week or two on peroxide nebulization, and improvement in quality of bowel movements like people have never had in their lives. That was the case with me. So all I will tell you is gluten and peanuts are uniquely antigenic proteins, but they're still proteins. And if your gut doesn't leak, you allow it to heal, you stop poisoning it with new pathogens and toxins, it's going to heal, and you're going to start properly digesting gluten and peanuts into their constituent amino acids, and these syndromes are going to resolve completely. So this is what I've talked about quite a bit already, is the pathogens that remain. And we're seeing more and more now that this is the case, especially with COVID. I mean, a lot of people will get over a cold or get over an influenza, and depending on how young or debilitated they are, they'll feel great a few days to a week later. Not so much with COVID. We're seeing lots of chronic COVID, lots of long haul COVID, and it would appear that it's even more effective in maintaining this chronic pathogen colonization than some of these other infections. Where is it located? Well, I've said it. Here's a slide. It's called the aerodigestive tract, your upper GI tract versus your lower. Aerodigestive is sinuses, nasopharynx, oropharynx and throat, tonsils and lymphoid tissues. The upper and lower bronchial tree mucosa, many docs think the lungs are sterile. They're not. They have a normal flora. Then the tongue, which is a major source of chronic pathogen colonization, and the esophagus itself. I mentioned this already. Now, people always say, well, what do I nebulize with? What kind of unit do I buy? Well, they make this type and they make the handheld. The handheld is great if you got a lot of money, you don't mind it breaking down, buying a new one. It's good, portable, walk around with it, travel with it. It does a good job, but they break easily. They seem to rust easily, and they have a planned obsolescence. On the other hand, just get yourself a good tabletop nebulizer. It's simple, it's cheap. You might be able to vary the price by depending on how big or small it is, but these things should last most people a lifetime. So $130 investment, and then nothing to rust, or because all this is doing is pumping air and then up to this little special nebulization chamber. And that's where you put in the peroxide or whatever agent you're going to nebulize. So all you need to do on these things is to clean the nebulization chamber and clean the mask, however frequently you feel inclined to. Now, COVID and the spike protein. There's an increasing amount of literature out there about this spike protein. I think everybody's seen the animation of the COVID virion, which looks like a little ball surrounded by spikes. I like to call it something that looks like a porcupine, like central core, and the spear-like appendages that come out. And very much so when they encounter the cells that they're going to invade, they literally stick into the cells, and then that sticking allows them to express dissolving enzymes that then permit entry of the whole virus particle into the cell where replication to take place. Now, just a technical point, because you're going to see a lot of it if you look at the literature. The attachment sites on the cell membrane are called ACE2 receptors, angiotensin converting enzyme receptors. Important to note, when these receptors are blocked or otherwise bound up by something else, the virus cannot enter the cell. Now, these ACE2 receptors are found throughout the body. This is why COVID appears to affect so many different organ systems, so many different cells with such a wide variety. of clinical presentations because everybody has different weak spots, if you will. Now, the ACE2 receptors are especially high concentration on the epithelial cells lining the airways, and this causes a disproportionate amount of attraction of the virus initially to the lungs, also because your initial exposure is virtually always respiratory. And this is largely the reason then why you get such a rapid progression in terms of respiratory distress and having a respiratory syndrome with extremely low blood oxygen levels, and then finally getting something that's known as the highly pro-oxidant cytokine storm. Now, something that's also being noted is the spike protein appears to replicate itself, independent of being attached to the entire COVID virus particle. And this is enormously significant for the long haul COVID and chronic COVID patients and the post-vaccine patients that are having problems, is they appear to have a prolonged and profound and nonstop production of the spike protein. It's not yet been well worked out if this is something that continues for a while, indefinitely, forever. We don't really know that yet. But we see that when this occurs, there's an increased tendency toward blood clots. And this is associated with a blood test called the D-dimer test. So you should never have an abnormal D-dimer test unless you have abnormal blood clotting taking place in your body. And it can be large clots, macroscopic, or it can be tiny blood clots, microscopic, in your body. Now, pick a perfect time to cut my grass. Okay. Now, I'm not sure all vaccines are the same, and I'm not sure all are of the same potency. There's some wondering about why some people do so poorly after a vaccine and many appear to do well. I really don't think we have the final evidence on that, except to say that what I'm going to show you right now, just a moment. So I'm going to show you right now a couple patients who had a vaccination and were basically feeling fine. All right. First, I want to tell you that what the significance of this D-dimer is in another context is the important thing is for the circulating blood to get through the capillaries easily. All right. If the blood doesn't circulate easily, oxygenation suffers, blood pressure rises, and everything starts to deteriorate. Now, bear in mind, when you have a single red blood cell, the capillary is so tiny, the red blood cell, one red blood cell literally needs to deform or fold slightly to pass through the capillary. Well, we have something called, under conditions of inflammation and increased oxidative stress, red blood cells can aggregate face to face and form coin-like stacks, and even branching of the stacks. This is known as rouleau formation. As I just mentioned, this results in increased resistance to blood flow and increased or decreased optimal transport of oxygen. And we know both of those things are primary problems in severely evolving COVID. Now, they have something called dark field blood examination. That's just a technique where it's very easy to look at the red blood cells, look at their morphology. This first slide, a 62-year-old lady who had received the COVID vaccine 2 months earlier, decided to get this examination. I don't think she was having any problems to speak of, but she knew about the test and wanted to get it done. Here, we see mild rouleau formation. A few of the red blood cells are sticking together, clumping. This is what you call mild, not even moderate, not even severe. And she was in a position to get repeated ozonations of her blood, autohemotherapy. After she had 6 of these done, she probably didn't need 6 to get this effect, because I'll show you in a moment. She had this picture on her blood, went back to completely normal. Now, we have another young fella whose father was running this laboratory, feeling fine, and only 15 days after his vaccination. So he decided to get the dark field examination. And I've never seen rouleau formation like this in my life. There's not a red blood cell that's not stuck to another red blood cell. Now, you can only imagine how this affects oxygenation, how this affects resistance and easy passage and perfusion of the tissues. In this case, and I re-emphasize, he was feeling fine. So whatever this is at an asymptomatic level. Well, he subsequently, his father had him get a 400 cc infusion of ozonated saline, followed by 15 grams of vitamin C intravenously, and then he came back to this picture immediately. Of note is, at my request, I said, well, check him again later on. So they repeated the dark field examination 2 weeks later, and it's still normal. Now, that's not an absolute assurance that no more spike protein is being produced, but it's a good assurance that there's a prolonged effect, possibly resolution, but at least a prolonged effect if you keep your biooxidative therapy, such as vitamin C and hydrogen peroxide, on a regular basis. This was later. Now, let's see. So whenever you're dealing with this, you want to design a protocol that interferes with new binding to spike protein, neutralizes old spike protein. I didn't have a chance to emphasize it at the outset, but vitamin C intravenously is your ultimate nonspecific antidote for any poison, any pro-oxidant, any toxin. There's never yet been discovered a toxin against which vitamin C has been tested that it will not neutralize or negate the negative clinical impact of. So in addition to everything else, literature has shown that the spike protein has an intrinsic toxicity, so vitamin C is able to neutralize that as well. So what do you want to do? Well, if you're not feeling well, for sure, if you're doing the long haul COVID, but I would also consider doing this if you had the vaccine, whether you wanted to have it or not, whether you were forced to have it or not, this would still be an excellent regimen to give you a good assurance, reasonable assurance, that you won't run into any sort of problems long-term down the road. Initially, high dose vitamin C. I give you here some information, 15 to 50 grams infusion, a good liposome encapsulated form orally. And even if you don't have that, just high doses, bowel tolerance doses of sodium ascorbate vitamin C powder. Another thing not on this slide is if you have an open-minded doc who wants to work with you, we now know that a limited dosing of hydrocortisone, this doesn't have the side effects that you hear about with prednisone and all these other things, but a limited low course of hydrocortisone, anywhere from 10 to 20 milligrams, 25 milligrams with each infusion or with each oral dose of the vitamin C early on for the first week, really pushes the vitamin C into the cell and gives you your best chance at completely normalizing the cells and completely eliminating any increased intracellular oxidative stress. Definitely the hydrogen peroxide nebulization. I already told you that chronic COVID, long haul COVID, and post-COVID vaccine, appear to have reasonably similar scenarios where you need to make sure there's no residual intact virus present, and that you knock that out completely and try to normalize the gut and the barrier function of the intestine as well as possible. The next three we've talked about: ivermectin, hydroxychloroquine, chloroquine, if available, ozone or ultraviolet blood irradiation, and then these primary supplementations that I mentioned. Now, this final slide, these are two articles that go into more detail of what I just said: website, email. Here's two free downloads, one for rapid virus recovery and the other one for hidden epidemic. And I just mentioned anybody can email me, but I don't do consultations. So please don't waste your time telling me I've got this, this, and this. What do I do? If you have a specific question and I can lead you to more information, I'm more than happy, but I cannot give you specific medical advice for your condition. So there we go. Thank you very much.
I have a question while the things are being written. A couple of us in the cardio group have been nebulizing, and for a few weeks it stopped now, but for a few weeks when I would blow my nose, a little blood would come out, like broken capillaries. And I wondered if that was similar to like bleeding gums. If you have tender gums, do you have chronic sinusitis? Can they be, because now I don't get little blood at all, or you know what that is?
Sure, just like the gums. I mean, that's ultimately a vitamin C deficiency. I mean, when your vitamin C levels are normal and high, you have a good strength of the capillaries. And I'm not saying you're never going to have a little bit of bleeding, but that type of thing doesn't happen.
So it's a localized C deficiency, sort of like a localized, because I've been thinking
like if you had localized problems there, they're going to cause, in many sense of the word, a focal type of scurvy. So, I mean, wherever you're consuming the vitamin C is going to cause the vitamin C deficiency problem. Generally, scurvy in the old sense of the Navy, of the British naval unit going out for months at a time, that's body-wide. But when you have any focal oxidative stress, you focally consume vitamin C. Atherosclerosis, as we discussed, is a focal scurvy of the coronary artery.
Great. Let's see.
They're asking, do I recommend vitamin C from liveonlabs.com? Yes, absolutely. I have an article on my website. Most liposome preparations and not most, but all homemade liposome preparations are frauds, at least with regard to true liposomes. So absolutely. I've been a consultant to LivOn for 15 or 16 years. If that makes a difference for my recommendation, that's up to you. But I'm telling you, if you're not going to buy true liposomes, such as from LivOn Labs, just buy regular vitamin C, but don't waste your money on the other preparations. They don't have liposomes. Air pump, the different variations are in the nebulization chambers, but again, those are brands too. So anything that just delivers a nice mist is the way you want to go. And no recommendation on a specific brand.
Lily, again, amazing information, absolutely blown away. And all I wanted to say was actually that a friend of mine has got this long COVID for the last 4 weeks, and they came to me, we were talking about the other day, and they were saying it's very much this thrombosis thing about the red blood cells not being able to squeeze through the capillaries, which is exactly what you've stated there, which is just really blown me away as well. And I'm going to call them straight away and tell them what the hell they should do, because she's been ill for the last 4 weeks with high blood pressure, and she's never had high blood pressure in her life.
And they need to hit it hard, because I'm not going to say all, but I'm going to say a very large percentage of these long haul COVIDs, I believe, this is not documented, I believe have low grade chronic myocarditis as well, which just means you're just chewing up your heart function over time. And if you leave it completely unattended, you can be in heart failure 6 months to a year and a half down the road, in irreversible heart failure at that point in time. But if you hit the inflammation hard, that's all itis is, myocarditis, inflammation. Work hard on the vitamin C, if they can find an open-minded doc to give them a little hydrocortisone with it and push that C into the cell, you should be able to completely resolve that myocarditis. But that's why whatever they do when they start feeling better, and let's say when they feel completely normal, still hit it hard for several days to a week with whatever therapy you use to get there in order to assure complete resolution. Don't just stop all the wonderful things you did the moment you feel like you have a perfect day. That's not a good way to approach it.
Thank you.
I just wanted to ask, thank you so much for the information, but for the magnesium chloride, did you say it was 1 gram a day when you're fighting the infection?
Take what you can tolerate. Okay. If you can tolerate
okay.
a gram or gram and a half, great. Tolerate with regard to bowel tolerance. A lot. Okay. I mean, what do they do to prep you for a colonoscopy? You know, magnesium citrate.
Right.
So
okay.
Yeah.
Okay. Thank you so much. Information was amazing.
Okay.
Thanks.
Allie.
Hi. Okay, so this was a lot to take in because this is my first time really understanding any of this. So no, the first thing is you're saying to nebulize, you know, just to protect yourself from COVID, 1. Is that correct? And
That's
then
correct.
2, for ivermectin and hydroxychloroquine, where does one get that?
That's all by prescription. So I mean, you have to. Yeah. But you do your due diligence now in working to find a doctor, so that if something happens, you're not scrambling to try to.
To get it.
Get it at the last minute.
And then if we can't find that, the other things that you recommended are also very good on their own, correct?
That's correct.
Okay.
I mean, any one of those things, if you push hard on them, they'll probably do the job. It's just all a matter of what's available to you, what you can afford, a lot of those situations. Yeah.
And then for somebody, I have been vaccinated. So, and have been going back and forth on whether to get the booster or not. So, regardless, you're saying just go for it with all these therapies, right?
Right. And let's see. You're being forced to get the booster, or you're being offered the booster?
I'm just being offered, you know, okay. I just have always kind of gone along with what they say. And so I got the Johnson & Johnson. So yeah, I would love to hear your thoughts on that if you're able to.
Let's just say my silence speaks volumes. How's that?
Yeah, I'm hearing that.
Okay.
Would you suggest that she do a dark field microscope exam of her red blood cells right now?
At a D-dimer test, yeah. D-dimer is a very simple blood test, and it should be normal. It should not be abnormal.
Okay.
If it's abnormal, it means blood is clotting.
Okay.
Great, Allie. How about, how about Vince?
Thank you for the presentation, Doctor. Is there anything to be aware of or look for with regards to your source of hydrogen peroxide?
No, when you're, the over-the-counter peroxide is fine. And I've used it a lot. And certainly people start getting, in my opinion, a little over concerned about some of the stabilizers and everything that's present in over-the-counter peroxide. And there's nothing wrong with being concerned about it and going ahead and getting food-grade hydrogen peroxide, and either directly 3% or diluting it down as needed to be. But for goodness sakes, never deprive yourself of if you're ill at all already, of a hydrogen peroxide therapy just because it's from the over-the-counter bottle.
Great. I think we've got anyone else with questions? You could just unmic. Oh, there we go. Janelle.
Hi, Dr. Levy. Nice to see you again.
Hi.
I just wondered if you could put a finer point on the concentration. So the brown bottle, 3%, we can pour that straight into the nebulizer.
That's right.
But you mentioned the folks in Colombia were experiencing a little bit of difficulty with that. So
Well, I mean, if a million people do something, you're going to have a million different responses. So, I mean, some people do the 3%, no problem. And others, it starts burning a little bit. They start sneezing, gets down, the throat gets sore.
yeah,
I try to make it as clear in the book as possible. You need to adjust it so that it's comfortable. All right. Now, I mentioned the thing about Colombia because these were people that were dying, basically.
right.
And for the first time, they started inhaling something, and within seconds, they started breathing easier. They didn't want it messed with, you know. So if it irritates my nose, or I have a sneeze, or I have a cough, no problem. And the other thing too is what's counteracting. When you're infected, you're usually going to tolerate a much higher concentration because it's being utilized on the pathogens. But when you've done enough that you've knocked out all the pathogens, and then all the hydrogen peroxide has left to work on is normal mucosa, then that can be irritating a little more quickly. And although you can use water, there's a pretty good evidence now that if you do further dilution, use either normal saline or hypertonic saline. I mean, you actually remember what I said about what the effect sodium chloride has. Chloride. I mean, when you're a kid, your grandmother said to your sore throat, gargle with salt water. It works. The chloride ion is significant. Also, when you do the normal saline or a slightly hypertonic saline, an increased salt concentration, it's concentrated, so it pulls fluid out. And that makes it easier to mobilize secretions that you need to cough up.
Interesting. Thank you.
Sure.
And thank you for today. Thank you very much.
Okay. You're welcome.
Grant, your hand up.
Yeah, thanks, Jack. Can you hear me?
Yeah.
Dr. Levy. Okay, we're hearing a lot, or I'm hearing a lot recently about the myocarditis, post-vaccine myocarditis from, kids through to adults through to elite athletes. Is it reversible? Is it something, that's one question. Is it a degenerative disease, myocarditis? Sort of two questions there. And what is the traditional allopathic treatment for that, opposed to what you've outlined in your presentation today?
Traditional allopathic is next to nothing. Or they put you on high dose steroids and it cools off a little bit, and then you have to end up dealing with your high dose steroid side effects, diabetes, and a number of other things like that you get when you take steroids for a long period of time. It's not like I have a series of myocarditis patients, so I'm going to tell you what I believe to be the case, okay? And that is, it's an acute inflammation, and like any acute inflammation, if you get enough magnesium and vitamin C inside the cell, you normalize the cell, you cool off the inflammation. And in that regard, I think intravenous vitamin C with, let's just pick a figures, different body size, different figures. 150-pound person to 175-pound person, 50 grams of vitamin C, 25 to 50 milligrams of hydrocortisone. I think if you do that 3 or 4 times, it'll be fine. Okay. Again, I don't have a clinical series for you. I'm just telling you that's my understanding of the pathophysiology. And a lot of times, many of the symptoms of long haul COVID are shortness of breath, and sometimes not necessarily low oxygenation. Shortness of breath, even a little chest discomfort, and at all ages. I mean, when you have a viral infection and you're 35 years old, you shouldn't have developed a chest pain syndrome. Or you should be able to walk up one flight of stairs without stopping 3 times. So these long haul COVIDs are, and the post-vaccine impact that we're seeing is, well, becoming more major every day. There's a video out there, but let me just tell you, if you haven't seen it, in the past 4 months, I believe, 4 freaking months, 75 to 80 elite European athletes have dropped dead.
Yeah, I've seen that.
Okay, and then you can see them collapsing on the field. Now,
Sure.
having said that, if there was nothing going on, you should have one elite athlete maybe every 10 to 15 years dropping dead because of some congenital heart defect or arrhythmia. So this is a serious red flag. And I don't think all the vaccines are the same. The other example I like to use is what happens, or how do you explain? Let's not call it a vaccine for a moment. Let's just call it an injection. If a 25-year-old kid, man, perfectly healthy, gets an injection and 2 days later is dead of myocarditis, advanced, and is there any possible way the identical injection be given to a chronically ill 86-year-old and not kill him? No, it's not possible. They're not the same injection. Beyond that, that's my hypothetical. Inadvertent, I don't know, but they're not all hot shots.
Yeah, thanks, Dr. Levy. Yeah, I heard an interesting discussion earlier today. A well-known podcaster in America, Joe Rogan, was talking about a professional free diver. He's one of the elite athletes in the world, can hold his breath up to 8 to 10 minutes, I think it is. And he's been struck down with myocarditis after his second Pfizer vaccine. And basically allopathic medicine has said, well, your career's over and that's that. But he actually wrote some very interesting, he'll put some information on Instagram, and highly recommended to people to be very careful about the choice of vaccine, and that the preference would be for the older style of vaccines, such as, Sinovac, Sinopharm, I think Sputnik as well, which is and I'm not a medical person, so I don't know the difference. I know it's non-mRNA, I know that obviously, but they all recommend, he was highly recommending the older style of the vaccine.
Right. Okay.
Thank you very much for your comments.
Sure. Pursue this protocol as vigorously as possible. The long haul COVID or post-COVID vaccine protocol that I like, I would adopt as many parts of it as I could and do them vigorously for a couple of weeks and then back off dosage wise, depending on which thing you're doing. I mean, there's not a well worked out protocol. These are all different things. So, I mean, people like, well, what do I take of this? What do I take? Can't give you that. I guess got to tell you, pursue it hard. And also, do the D-dimer test. And if the D-dimer test is positive, don't stop until it's negative. What can I say? I can tell you that, at least in the United States, what we hear on the news is in complete and total direct conflict, the opposite of what we see when we do the research to look at different scientific studies. All the studies that I've looked at indicate a high degree of miscarriage in women that have received the vaccine and then go out and get pregnant, or that get the vaccine when they are pregnant. Okay. Now, of course, what those studies did not address is what effect these interventions that I mentioned to you might have. We don't have that answer. Exactly the point. We should realize now that most adults, especially older adults, have infected teeth, have different problems, and when they're exposed to anything that's highly toxic, they're not going to have the same response as others. So I can't tell you for sure why somebody might be struck with tinnitus, but definitely if you already have underlying chronic infections in your mouth, that's just going to provoke them into different types of manifestations when you put another infective load on the body. There's not a myocarditis test. I mean,
Oh, there isn't.
you got, well, I mean, you nuclear scans and other things like this. I mean, that's not something you're just going to get without your doctor taking you through it and your insurance and all this. So that's why you need to go with these other examinations that I'm talking about, along with symptomatology. Okay, so but like we showed in those two examples on the dark field, somebody says, is dark field the same as D-dimer? No, dark field microscopy, D-dimer blood test, D-I-M-E-R, D-dimer. And no, is some people have these findings and they feel perfectly fine. So we're just feeling our way through the forest here. So I'm just giving you what I consider to be my best approach at this point in time. Might have stuff to add or subtract in a month. I don't know. Remember that I kind of say this a lot, but I can't overemphasize it enough. I mean, you need to find a health care person, not necessarily a physician, maybe a physician that really is interested in talking to you, working with you, explaining to you. If you just go throw your warm body at the mercy of the first doctor you can find, you're going to be extraordinarily lucky if you get better. So you have to be your own best advocate health-wise, period. No other way to put it around. And I would think most of the people that have been listening would be of that mindset. So that's all I have to say. Thank you.
Bless you. Thank you. Have a good night.
All right.
Thanks,
Take
Dr.
care.
Levy.
All right. Bye-bye.